Hello everyone, myself Prashita from Department of Pharmaceutical Chemistry and Analysis, School of Pharmaceutical Science, VISTAS. Today we are going to see about it, essential elements for effective communications in an healthcare profession. What does mean by effective communications? Effective communication, which is nothing but exchange of informations, ideas, and emotions in a clear, accurate, respectful, and timely manner. Why it is important? It enhances a patient's safety, which improves the patient satisfactions and build the trust and reduces the medical errors, and it increases and promotes in teamwork and support a better clinical outcomes. And now we are going to see about it, 7 essential elements for effective communication. First one is an active listening. Pay full attention, avoid interruption, and show that you are listening. And next one is an empathy. Yes, understand and share the feeling of others and show compassion and care. And third one is a simple clear languages. Use a simple jargon free languages that is easy to understand. And fourth one is a non-verbal communication. Use appropriate body languages, facial expressions, eye contacts, and tones of voices. And fifth one, respect and cultural sensitivity. Treat everyone with respect and be aware of cultural differences and values. And sixth one is then a feedback and then confirmations. Encourage questions, provides feedback and confirm understandings. And seventh one is a professionalism. Maintain honesty, confidentiality, punctuality, and a professional attitude at all the times. First, we are going to see about an active listening. Every patient has a story. Listen carefully. What is an active learning? Giving a full attention to the speakers while understand both verbal and non-verbal messages. And what are the techniques? Maintain eye contact, avoid interrupting, and ask open-ended questions. Summarize what the patient says and clarify unclear informations. And some benefits, we can see some benefits. Yes, benefits like builds trust, encourage patients participations, and improve diagnosis accuracies. Good listening is a first step to good care. Next, we are going to see about an empathy. See their pain, feel their heart. What does mean by empathy? Empathy is an understanding and acknowledging another person's feelings while responding with compassion. For example, if you are saying, I know how you feel, you can say, I understand the situation is difficult for you. Yes, you can use soft, concerned words and show your empathy, and you can console them. And some benefits like it reduces in patient anxieties, strengthen therapeutic relationships, and improves a patient satisfaction. And next point about it, clear and simple languages. Yes, use some simple languages which they can understand easily. Yes, for example, if you're using an hypertension word, no, you can say simply high blood pressure. Yes, and when you're simply saying administered orally twice a daily. Yes, instead of that, you can say take one tablet by mouth twice a day. It's very simple and clear, right? Yes, so these type of clear and simple languages will be understanding for a better care. And next we are going to talk about non-verbal communications. Yes, body language speaks before words. It includes like facial expressions, eye contact, body postures, gestures, and tone of voices. And you know that research suggested that a large portion of communication is conveyed through a non-verbal clues. Yes, a 7% of words and 38% of tone of voice and 55% of body language of which is includes a non-verbal clues. Actually, you should have in good practices like a smile appropriately and maintain open postures and nod to show your understanding and respect their personal space. Point about and respect and cultural sensitivity. Yes, respect. Treat every patient with a dignity. Respect their privacy and confidentiality and avoid discriminations. Yes, if you comes for a cultural sensitivity, respect their cultural beliefs and practices, and consider languages preferences, and use an interpreters when necessary. Yes, better patient cooperation and trust will be your best outcome because of respect and cultural sensitivity. Yes, next is about and feedback and confirmations. Yes, ask the patients to explain the instructions in their own words. For example, can you tell me how you will take your medicines at home? Yes, you can ask like this. Yes, when we confirm understanding, we build confidence, prevent errors, and support better health. And what are the benefits? A benefits like a confirms understandings. Yes, then you can prevent and misunderstandings and improves in treatment adherence. Yes, last but not least, we are going to talk about an professionalism, which includes an honesty, confidentiality, accountability, respect, timely communications, and ethical behavior. Yes, honesty. Be truthful and transparent in all the communications. Next is confidentialities. Yes, protect a patient's information, share only a need to know basis. And accountability. Take responsibility of your words, actions, and decisions. Next is respect. Treat everyone with dignity and respect. Next is timely communications, provides information at the right time. Ethical behavior. Follow ethical principles and professional standards. Professionalism is not just what we do, but how we communicate every day. Yes, coming to the conclusions. Effective communications is not just about a sharing information. It is about building a trust, ensuring understanding, and delivering a safe, patient-centered care. Yes, thank you so much. If you like it, like it. If you love it, share it.